Hi, I'm Dr. Melanie with Venture Chiropractic. I'm a chiropractor here, and today we're going to be continuing our series on torticollis. First, we're going to cover treatment options that we can offer in the office for the babies, and then we're also going to cover what we would do with an older child. So a lot of the times when infants come in, it is typically either through observation of a parent or a referral from one of the medical professionals in the community that send them in. The child tends to have a head tilt and a head turn. So what we want to do, we want to help encourage that child and guide them into the movement where they can get back to center. So as their head is here, what I first kind of run through after we've diagnosed that it's torticollis, we know what we're working with, is starting to do some gentle muscle work. I will find the muscle that is shortened or tightened right through here, and with a little pincer grip, I will work and rub through that muscle, or we'll grab and I'll do little wiggles all the way down. The important thing about doing muscle work is that it helps prepare and loosen the neck muscles so that the baby is more prepared for when we get closer to the adjustment. Same thing, the shoulder typically tends to be high, so a lot of times while I'm doing the stretches, I'll be slightly holding that shoulder down. Then, as we move a little bit further, I want to help encourage range of motion. So with that and the baby's head being tilted, I will make a contact, not on the baby's jaw, but on the forehead. And as we're making a contact to the forehead, I will gently keep that arm held down, and we will do a little tilt away. A lot of times as the child is sitting in my lap in this position, they may fuss a little bit. Having mom in front or dad around can help ease that discomfort. And we just slowly tilt and move, holding about 3 to 5 seconds with each movement. We go a little bit further until we meet a lot of resistance. So that's with the side bend. With rotation, I will cradle their head, and with this we want to turn, because their head is turned this way, we want to go the opposite direction. So very gently, again, making a contact on the forehead, we will help slowly encourage baby to turn, holding and waiting, holding and waiting. We go until we meet resistance. Then once we've done muscle work, we've worked through some range of motion, I will then get to the point where we're going to adjust. Again, this is what is tolerable for the child, what their comfort level is, and the parents. I tend to prefer to use my fingers just because I can really control my pressure when I'm adjusting. My hand will make contact to the area that is not moving in their neck. My finger presses down. You can see potentially my nail slightly turning color. And then I will help guide that joint either with a sustained contact, with a little wiggle, maybe a little movement this way, until I feel a melting or a change in that joint movement. The goal of all of this is to reduce any discomfort that that child may be having, improving range of motion, and making that joint space move better. So that is care that we will often do in the office with the infant. All right, now with my lovely assistant, you want to say who you are?
Fiona.
Fiona. We are going to show you what we're going to do with torticollis in an older child. So it doesn't happen as often that an older child will come into the office with a head tilt and spasm of the SCM muscle, but it does occur from time to time. So she's going to show us some of the things in a seated position, what we will do and work on. Okay, so Fiona, let's have you pretend. You can stay seated. She's going to have her head tilted here and turned away in this direction. So often when we are trying to and the child is trying to turn and tilt their head, they cannot move, and it usually causes a bit of discomfort or pain in a child Fiona's age. So we want to, again, loosen the muscle. So I'll start doing some muscle work and rubbing all through from the neck down to the shoulders, even the side that is tilted. I will hold and we will work and rub the muscle all through here. We continue to work gradually up to the patient's tolerance and what they can handle. Next, Fiona's going to show us what we will do for active and passive stretching. So a lot of the times, again, the shoulder will be elevated a little bit. So we're going to keep you in this head tilt, sweetie, right there. Okay, so now Fiona's going to work on trying to turn. So her head is tilted this way. We want to have her turn over to the left. So my hand is going to be here. Fiona, with a little bit of pressure, can you turn into my hand? There you go. 1, 2, 3, and you may relax. Take a nice deep breath. Sit up nice and tall. There you go. All right. Can you turn into my hand again? 1, 2, 3, and relax. And some of them too, it may feel more comfortable just to kind of guide and help guide them and encourage them into that position. Next, I want Fiona to tilt into this side of the shoulder. So my hand is going to rest over here. She's still caught in this position because she can't move. My hand is going to be right here. And Fiona, if you can press into my hand where I'm tapping, right up through here. Press a little bit. 1, 2, 3, and relax. And then press one more time. 1, 2, 3, and relax. We continue to go back and forth doing this motion to try to improve that range of motion of the muscle for a little bit. Eventually we get to a point where if the joint is not moving very well, we're going to want to introduce an adjustment into that area. So with an older child, I may use a little bit more of a contact. We may have a little bit of motion happening in the neck. Often we'll lay on the table. So Fiona, can you show how you would lay on the table? So I tend to help them down. So again, she's kind of protecting her head right here. Lay on your back, please. And they will lay on their back. Once they're laying on their back, this is where I will come to the front of the table, help feel the neck. We may do a little bit more stretching or muscle work, and I will make my contact. A lot of the times when we are at the point where we're doing the adjustment, I will often make sure that it's okay with the parents that I proceed, and then I'll look to the child and ask if they're ready. We will work through it together, breathing, doing gentle movements until that joint is moving better. And at that point, they are often may feel a little bit of discomfort, but we hope to be moving forward with less pain, better motion very soon. Again, I love to co-manage torticollis cases with other OTs, PTs, medical professionals, oral myologists in the town, and sometimes there is a case where we are working together as a team to help these kiddos feel better. It's really important to get to the root of the problem. If it happens more than once, we really need to find out the reasoning why it's occurring. Our goal, whether we're working with infants, kids, or older individuals, is to help them move better, feel better, and be a better you. Please like or subscribe if you would like to see more videos like this. In the next video, we are going to be covering prevention and home exercises.